Welcome to this afternoon's webinar on Michigan Emergency Seclusion and Restraint. My name is Cindy Shinsky, and I am currently your Director of Special Education, at least for another 2 weeks. I really appreciate you joining the call today. What we're going to do today is cover 3 key areas. One is going to be a general overview of key information and requirements of the legislation specific to the Michigan Emergency Seclusion and Restraint. We are trying to satisfy the requirements for comprehensive PD for key identified staff. I'm going to pause for just a minute because somebody's computer is still not set up on mute. Are we set now, you think? Okay. All right. We're going to be satisfying the requirements under the legislation for key identified staff to receive comprehensive PD. Key identified staff are your building emergency response team members. And we're also going to share resources to help support your school's implementation and compliance with the Michigan Seclusion and Restraint legislation. I want to start by talking about the legislation. The legislation around emergency seclusion and restraint was revised and was signed into law by the governor at the end of December of 2016. It became effective on March 29, 2017, and it specifically limits the use of seclusion and restraint to only emergency situations. So prior to this legislation, we had legislation on seclusion and restraint, but it wasn't specific to limiting when it could and couldn't be used. So this legislation really zeroed in on not only limiting the use, but identifying additional components. It required the Department of Education to develop state policies specific to the legislation, and requires school boards to adopt and implement policy consistent with the state legislation or policy statements no later than the start of the 17-18 school year. And so your boards of education should have all addressed the revisions to the legislation sometime during the summer, maybe even as late as last June, but certainly before school started. Who does this impact? This legislation applies to all public schools, our local districts, our ISDs, and our charter schools. This is not special education legislation. This legislation applies to all students. The other thing I want you to know is because this is part of the revised school code, anytime there's a violation of the school code, in other words, the school district fails to implement the legislation that's included in the school code, it's considered a misdemeanor. And when there's a misdemeanor, the aggrieved party also has the right to seek remedies under state and federal law, of which we want to avoid. The intent of the legislation covers 4 key areas. 1 is to promote the care, safety, welfare, and the security of our school community, and also the dignity of the student. 2, to encourage use of proactive, effective, evidence and research-based strategies, and we're talking about behavior strategies here, and best practices that reduce the reoccurrence of challenging behavior, eliminate the need to use emergency seclusion and restraint, and increases meaningful instructional time, not only for the student who's having emotional meltdowns, but also for all students within the school environment. 3 is to ensure that emergency seclusion or restraint is only used as a last resort in emergency situations, and it's subject to, or that we implement on the school's end, a process for diligent assessment, monitoring, documentation, and reporting by trained personnel. Thus the reason you're participating in today's training. It also clarifies, the legislation clarifies terms, and required procedures. The legislation requires that we provide information about what are prohibited practices. Now, these practices that are listed on the slide in front of you have been prohibited practices, so this is not anything new. The newest requirement is that you can only use seclusion or restraint in an emergency situation. So corporal punishment, child abuse, depriving a child of basic needs such as not allowing them to go to the bathroom or eat, placing the child in a prone restraint, which is face down on the floor. And honestly, we should never use a restraint on the floor, whether the child is face down or face up. CPI training tells you that because it puts the child at risk for having a negative impact on their ability to breathe. We can't use chemical restraints such as giving the child an injection that chills them out, and we can't use some kind of mechanical restraint. For example, we can't use handcuffs. We can't place a child in a chair and put a lap belt on that prevents them from getting up. Those would all be considered, that would be considered a mechanical restraint, and all of these procedures are prohibited. So one might ask then, what is permitted? There are 9 specifically identified areas that allow for some form of physical intervention with a student. One is when there is a need to break up a fight or some type of physical assault or to take a weapon from a student. We're allowed to briefly hold a student to calm or to comfort them. When we say brief, we're talking about seconds, not minutes. Unless I would say the child is very young, a kindergartner, first grader, where we might place them on our lap and help calm them or have them sitting next to them with our hand on their back or on their leg, just trying to calm them down. Minimal contact is allowed when you're physically escorting a student from one area to another or assisting a student to complete a task, or a response if a student doesn't resist or resist that minimal assist. Let me give you 2 examples. A physical assist down the hall would be open hand on the child's shoulder or on their back, gently prompting them to come down the hall, or for a very young child, perhaps holding their hand. We should never grab the child's wrist and pull them down the hall. That would be considered a practice that's not permitted. Assist for completing a task. An example would be a hand over hand where a child is trying to write. We're trying to provide them with assistance in that writing. That again would be an allowable practice. Administering medications to a child that have been prescribed by a doctor and are being administered consistent with the doctor's directions. Use of adaptive or protective devices, as long as they're recommended by the physician or therapist and they're used as recommended. Use of safety equipment, such as a seat belt when a child is being transported. Actions that are part of sporting events, or procedures that need to be implemented as a result of an emergency within the building, such as the need to do a lockdown, a tornado drill, or fire drill, and we're trying to move the kids quickly from one area to another. There are very specific definitions of the term seclusion or restraint and physical restraint within the legislation. It's really critical that not only you understand the definitions, but also your staff understand the definitions. Seclusion is defined as confining a student in a space where the student is physically prevented from leaving. Restraint is an action that prevents or significantly restricts a student's movement. Physical restraint involves direct physical contact with the student. Oftentimes these terms are not clearly understood by staff, and as a consequence, when they're completing an incident report within MyNHA, we have incidents in which seclusion or restraint are actually marked, and yet the description doesn't coincide with the identified term. There are very specific definitions for what constitutes an emergency situation, and it's important to clearly understand this definition because, again, we are only allowed to use emergency, seclusion, restraint in a true emergency. An emergency is a situation in which a student's behavior poses an imminent risk to the student's safety and the safety of other persons, and it requires immediate intervention in order to protect the safety of the individual or others. An emergency situation is not created if property is the only thing at risk. And there have been situations in the past, prior to this legislation, when we've utilized the use of emergency, or maybe it's not an emergency, restraint, because a child is engaging in damage to property. It's really important to understand that we cannot use seclusion or restraint if what is happening is only damage to property. Let me give you an example. If a student is kicking a wall, they've cleaned off a tabletop, they've knocked over a chair, they're throwing books, but it's not in the direction where somebody's going to get hurt, we could not use physical restraint. However, if the student is going to knock over a bookshelf and there are students that are in the way, or that child might get hurt, or if they're kicking, for example, a trophy case, and the trophy case is made out of glass and wood, and the child is kicking the wood, but if they move 2 inches, 3 inches to the right, they're going to shatter the glass, and there's a high probability that that might happen, and that as a result of that, the child would get or could get seriously injured. That would be an indication of when we could use emergency restraint. It must be a last resort emergency safety intervention solution. An emergency seclusion is also a last resort emergency safety intervention that involves seclusion in an ongoing emergency situation and until the pupil is able to gain self-control. In other words, if we're going to place a student in seclusion, that child can only be in seclusion until they've regained control. And if that's 2 minutes, then the child's out of seclusion. If it's 5 minutes, they stay in until they're ready to they've regained control. It also must be required that we're trying to maintain the safety not only of this pupil but other pupils, and that would be the only time that we can use seclusion. To qualify as an emergency seclusion, we must continuously be observing the pupil. In other words, there are very specific requirements that must be met when we're going to utilize emergency seclusion, and one of those is that we have to be able to continuously observe the student. There are also very specific requirements about the use of the facilities that we're utilizing for the emergency seclusion space. It has to comply, the space must comply with the building and safety codes. The space cannot be locked. It cannot prevent the student from exiting in the event that the personnel who observing the student becomes incapacitated or leaves the area. And it has to provide for appropriate space, lighting, ventilation, viewing, safety, and the dignity of the pupil and others, and it has to meet the requirements of MDE's seclusion, emergency seclusion, and restraint policy language. We would never place a child in seclusion, for example, in a closet where we can't see them, or in a closet where there is, for example, a electrical box, or perhaps the technology wiring. There are also some specific parameters around emergency seclusion and when it may not be used, including we cannot use emergency seclusion with preschool children or severely self-injurious or students who are threatening suicide. Can't be done for the convenience of school staff or as a form of discipline or punishment. In other words, if we said to a student, if you continue engaging that behavior, you're going to go to seclusion, that would be then considered a form of discipline for the student. It would be considered a punishment, and that practice is totally prohibited. And again, the reason is that the only reason we use emergency seclusion is because of safety reasons and to help the student regain control. It also may not be used as a substitute for an education program, a less restrictive alternative, or for providing training and positive behavior interventions and supports. Emergency seclusion does not include the practices that are listed under 380.1307B of the legislation. That's a reference in the school code. And those are the practices that we already discussed, such as trying to take a weapon from the student. Seclusion cannot be used when it's contraindicated based on the pupil's disability, healthcare needs, medical or psychiatric condition that's documented and evidence of those needs are on record. In other words, there are certain situations in which we would not use emergency seclusion because it would actually be more damaging or pose a healthcare risk to the child. I'm going to just pause for a moment. Are there any questions so far? Caitlin, any questions coming through?
Nothing coming through.
All right. I'm going to move on to, so who are school personnel? School personnel are classified as employees of the district, anyone that is contracted and works within the school setting, and public school employees who are providing services at non-public schools. This particular provision doesn't really apply to us. However, it does for local school districts in which there are private schools within the district. There's a provision under the school code that requires that itinerant services are provided by the public school in a non-public schools, but that one doesn't apply to us in our setting. The legislation also requires a series of interventions on the school part. We have to provide a clear statement on prohibited practices for our school staff, when emergency seclusion and restraint can be used, with a clear indication that it can only be used in emergency situations and only if it's essential to providing for the safety of the pupil and for others. And it may not be used in place of lesser restrictive interventions. The use of seclusion or restraint must also be performed in a manner that is safe, appropriate, and proportionate to and sensitive to the severity of the student's behavior, their chronological and developmental age. Let me just stop there for a moment. So some of you might be saying, well, what do you mean by developmental age? We have some children who come to us with cognitive impairments, or they function as though they have a cognitive impairment. And an example might be a lower functioning student with autism. Chronologically, they might be 10 years old, but developmentally, they're functioning more like they're a 5-year-old. We need to intervene looking at the student as though they are 5 based on their developmental age, not based on their chronological age. We need to take into consideration the child's size, their gender, their physical condition, their medical condition, and their psychiatric condition, in addition to whether or not that child has a history of physical abuse or some form of trauma. Again, what we don't want to do is actually traumatize a child more by implementing our procedures, and so we want to be very, very cautious and careful about how we proceed. The legislation also provides for and identifies the need for key identified personnel to only be the individuals who implement emergency seclusion or restraint. And if we're in a situation, let's say a general ed teacher is in a situation where she believes that there's going to need to be the use of emergency seclusion or restraint, or perhaps they're intervening, there's an expectation that the key identified personnel in your building, again, as I stated earlier, key identified personnel are the same individuals that we have classified as our emergency response team. So if we have an emergency situation, we think we might need to implement seclusion or restraint or emergency seclusion or restraint, we need to call our key identified personnel immediately, and they need to take over the situation to provide for the safety not only of the student but for others. We also have a provision that says that all substitute teachers need to be aware of and trained in emergency seclusion and restraint procedures at the awareness level. And that staff need to clearly understand that we can only use emergency seclusion and restraint until the student has regained control. And if we're in a situation where emergency seclusion and restraint needs to take place longer than the permissible time frame included in the legislation, that there is a requirement to add or call additional support, and there's additional documentation requirements. So let's take a look at the limits on the amount of time for seclusion or restraint. The legislation is very clear that we may not utilize seclusion for more than 15 minutes for elementary students and 20 minutes for middle school and high school students. In addition, restraint cannot be used for more than 10 minutes for either elementary or middle school students. However, there's also a recognition that an emergency situation could last longer than this time frame. And in the event that that happens, again, you have to call additional staff. You have to document the reasons for the extension of the timeline.
Yes, ma'am. It is, in fact, on my desk.
I'm going to just pause for a moment. If you could make sure that you're muted, I greatly appreciate it because it is interfering with the presentation. Thank you so much for your help. When a child is in a situation where, whether it's within the time limits or it's as a result of an extension of the time limits, we have to be observing for any signs of physical distress. And if a child is engaging in any signs of physical distress, we need to seek medical help for the child. And we'll talk about what that looks like toward the end of this presentation. If we're utilizing some form of restraint, we also have to make sure that for a child who uses a mode of communication that's other than verbal, for example, a child's hearing impaired and they use sign language, or we have a child that's physically impaired or has limited language ability as a result of a disability, and they're using assistive technology, we need to limit how much we're restricting the child's ability to utilize their mode of communication to the extent that's practicable. And let me take a minute to explain what that means. If a child utilizes assistive tech or they use sign language, but they are still in distress, they are trying to swing, they're trying to hit somebody, we would not release the student from a physical hold so that they can use their sign language or their assistive device because they're still engaging in behaviors that are dangerous or posing a danger not only to themselves but others. So when we say practicable, we have to take into consideration the circumstances that are happening. We also need to make sure that there's a person there who can utilize the child's primary mode of communication. For example, if a child is hearing impaired and they have a sign language interpreter, then we need to make sure that the sign language interpreter is there to help communicate for the child. In the event that we engage in emergency seclusion and restraint, there's also documentation and reporting requirements. So I'm going to talk about that in just a moment. Before I go there, I'd like to know if there are any questions. No questions? All right, then I'm going to continue. Every incident of emergency seclusion under restraint must be documented. So someone might say, well, what if a child engages in more than one incident in a day in which it requires either seclusion or emergency restraint? Well, each incident must be documented, therefore there would be 2 reports during that day. If there's an incident, there's an expectation that you must immediately inform the building principal, and we also must immediately inform the parent. Now, immediately is not defined, but I would say to you that as soon as the situation is back under control, the child has regained control, that contact needs to be made with the parent so that the parent is made aware of the circumstances. In addition, we have to provide a written report to the parent. Now I'm going to read this to you. Parent earlier of 1 school day or 7 calendar days. Let me define what that means. We have always had a policy that says that if there's an incident of emergency seclusion or restraint, we need to give the parent a copy of our written report within 1 school day. What this part of the legislation takes into consideration is that we could have a break in instruction, for example, Thanksgiving break. So if we had a behavioral incident that happened in the afternoon on the Wednesday before Thanksgiving, we might not have sufficient time to complete the report and get it to the parent. So this portion of the legislation says, well, or the earlier of 7 calendar days. So we could have until the following Monday to provide the parent with that report. So it takes into consideration those short breaks. Here's the problem with the legislation. If the same incident happened on the Friday prior to a 2-week Christmas break, we still must provide the parent with the written documentation within 7 calendar days. That would fall in the middle of Christmas break. And so my recommendation to you, so that you're in compliance with the timeline requirement, is that any time that there's an incident of emergency seclusion or restraint, we immediately, the same day, provide the parent with a copy of the report. That way you're always in compliance with the required timelines. There's also a requirement within the legislation that we make an effort to debrief and consult with the parent, and this says using the MDE guidelines and forms. In other words, within the legislation it is very specific that MDE needed to develop a debriefing form and guidelines associated with debriefing, and that we as a district are required to implement those procedures. Within the NHA documentation forms, we have emulated all of the requirements of the MDE document. The form is referenced as Form C, and so if you are using that form, you are meeting the requirements of the MDE documentation. The Q&A document created by the Department of Education specifies that the debriefing should happen within 1 to 3 school days following the behavioral incident. I'm going to say should. And the reason for that is because you want the incident fresh and you want to have a chance to review and determine what course of action you're going to take in order to help that child be successful in the school environment. We're required to invite the parent to that debriefing meeting. And I'll talk a little bit more about the content of the debriefing meeting in a moment. We're also required to collect, analyze, and submit electronically data specific to emergency seclusion or restraint. And we're required at a minimum to report each incident and include the student's race, age, gender, grade, disability, medical condition, the location in which the incident took place, and the school personnel who initiated the use of emergency seclusion or restraint. So if the incident started in a second grade classroom and the general ed teacher had to put her hands on the child to help keep them safe, then the school personnel that initiated the use of seclusion or restraint would be considered that general education teacher. If, on the other hand, the child was escalating, called for emergency backup support, and the first person that came in and then utilized the emergency seclusion or restraint was a key identified staff member, then that is the individual that would be recorded. And there's a location on the emergency seclusion and restraint documentation form. That form is Form B2 that allows for documenting of all of those required components. Any questions at this point? There's also an expectation within the legislation that a team of people are going to look at and determine whether or not there's a pattern of behavior that poses a substantial risk of creating an emergency situation in the future that could result in the need to use emergency seclusion and restraint. In other words, the team has to determine whether or not the child's behavior is likely to reoccur that would then necessitate the use of emergency seclusion or restraint. And if the team said, yeah, we think that could happen again, then they are obligated to develop an emergency intervention plan. We have built in that conversation into the debriefing meeting so that we're bridging the debriefing and this conversation together. If the answer to that question is yes, then as a function of developing an emergency intervention plan, you have to take a look at whether or not there's a need to develop an assessment plan to take a look at the function of the behavior. And if you're going to develop an emergency intervention plan, you must also develop a positive behavior support or behavior support plan. The behavior support plan that we've bridged into this process is the same plan that comes out of my NHA, out of the behavior module. It's the same plan that when there are a certain number of incidences that take place that trigger the need for a behavior support plan. The emergency behavior support plan, some of these things I've already said, but please keep in mind that it's designed to be proactive, to support the student, to provide interventions, and to teach and prevent the reoccurrence of the behavior. It's really, really important that great thought is put into how do we prevent the escalation in the behavior, and to look for signs of an escalation taking place so that proactive measures can be put into place to minimize the escalation or to prevent the escalation. And that's part of what needs to go into the positive behavior support plan. The emergency intervention plan has to be completed by, well, first of all, the parent needs to be invited to be a part of that team. That's why we've built it into the debriefing process so that you can move right from the debriefing into the conversation and development of the positive behavior support plan, or the review of a positive behavior support plan if one already exists, and then into the development of an emergency intervention plan if one is needed or is anticipated as being needed. The parent is part of the development of that plan, as well as the teacher that works with the child, and that could be multiple teachers, as well as somebody who is knowledgeable about seclusion and restraint and positive behavior supports. And you as a school have to determine who on your team is knowledgeable about those two pieces. There's kind of an expectation that if you are part of an emergency response team, that you have deep knowledge about the permissible practices under emergency seclusion and restraint, and that you have a knowledge base about positive behavior supports. And so I would suggest that that person be a member of your emergency response team. You have to be able to explain the intervention procedures and the legal limits and provide examples of those legal limits. For example, we can't engage in child abuse. There are certain circumstances under which we need to consult with the child's doctor. For example, if the parent says that the child has a heart condition, we would want to consult with the doctor to make sure that engaging in emergency seclusion or restraint would not put that child at risk. There's an additional requirement, which is new within the legislation, that requires that somebody that is knowledgeable about emergency seclusion and restraint and PBS, they have to do a peer review of what I'm going to call the draft emergency intervention plan before it can be implemented. And that's to have a second set of eyes take a look at and make sure that you're addressing all of the required components and that the plan is designed to teach the child. It's designed to have interventions, and that's that positive behavior support side, and that we're only implementing the emergency seclusion and restraint procedures in emergency situations, and that we have the proactive procedures clearly defined as well as the emergency procedures clearly defined. That's a secondary person and a secondary review, and so as a school team, it's going to be important for you to identify who are the people that you're going to classify as knowledgeable staff who can fulfill that role. In addition, there's an expectation and a requirement that we educate the child about the circumstances under which emergency seclusion and restraint will be used. And I'm going to encourage you to not only talk to the child about those circumstances, but that you actually show them what that could look like. So if you're going to implement some form of emergency restraint, that you show the child what a two-person hold looks like when they're in a calm state, so that they know what could happen and what it feels like. And hopefully through doing that, it will help the child learn why it's important to utilize alternative behavioral options, but also that they're aware of what could happen, because oftentimes when we're engaging in either emergency, well, especially some type of hold, you're going to see an escalation in behavior. It's a natural physiological response. The legislation also identifies 2 levels of required training. One is that we're required to provide awareness training for all school personnel, substitutes, and anyone that's working with children, including not working with, but working around children, including bus drivers. It would be our food service staff and our custodial staff. The awareness training, hopefully all of you have completed that training within your school. I really, really appreciate that you jumped on this and made sure your staff were trained. And moving forward, all new staff will receive that training through Encores as part of a PD plan. And it's just really important for you to make sure that your staff have received that training. For our contracted staff, such as building bridges and Dean Transportation, they have guaranteed, we've provided them with the link to the awareness training, and they have made a commitment to also provide and document the provision of the awareness training. We're working with food service as well as custodial, the cleaning service, and other transportation entities to also make sure that they are taking care of the training requirements. The secondary training that we're required to provide is classified as comprehensive training for school personnel for the key identified staff. That's why you all are on the call today. And again, we thank you for being part of this call or this webinar. This webinar is satisfying the requirement, or at least partially satisfying the requirement for the comprehensive training. So let's talk about what the training requirements are for the comprehensive training for key identified staff. As you look at your screen, you're going to see a whole series of training from proactive strategies and de-escalation strategies to dangerous behavior and risk, conducting a risk assessment. All of the items that are in blue are covered in the CPI training that you receive on an annual basis. CPI actually did a alignment analysis between the legislation and the training that they complete. Caitlin and I made a call to CPI, and we walked through the training and verified which components are covered through that training. There are 3 areas that are not covered, which is why we're providing the training today. One is the types and use of emergency seclusion and restraint, which has been covered in this training. How to obtain medical help, which will be covered in the next 2 slides. And the last area for which you may need to receive additional training is CPR and first aid. Now, many of our administrators participated in training this summer provided at Leadership Summit by Brian Gard. Also, many of our ISDs are providing training in CPR and first aid to help support schools meeting with this legislative requirement. I am recommending that all key identified personnel receive CPR and first aid, and the reason for that is if only 2 people are trained, they could literally be out of the building at the same time or be sick, and then we don't have the required personnel trained when we're providing either emergency seclusion and or restraint, which creates a compliance issue for our schools and a safety issue for our students. There are 4 areas that are recommended for training by our key identified personnel. These include conflict resolution, social skills training, mediation, and positive behavior interventions and supports. Conflict resolution, if you participated in the training at summer leadership around restorative practices, that's a form of conflict resolution. We also have 3 schools that are participating in the pilot implementation of a social skills curriculum. I do believe that our moral focus curriculum satisfies some of the components around social skills, at least at a tier 1 or the foundational level within our classrooms. However, there may be some children in your school who have more significant needs around developing social skills, and you may need to do something more intentional. And then, of course, any training that you can receive around positive behavioral supports and interventions and mediation can only help support you in your proactive approach to supporting students with challenging behaviors. Are there any questions so far? I'm going to just do a quick pause here. Any questions that you have? Caitlin, any questions coming through?
Not at this time.
I'm going to go ahead and proceed to the next 2 slides. So what are our appropriate measures in the event that we have a child who's engaging or demonstrating some form of medical distress while they're engaged in either emergency seclusion or restraint? Well, I've mislabeled this. These procedures are not in the parent-student handbook. They're actually in your building's emergency procedures handbook. And I would encourage you to get a hold of that handbook and to print this out so that you have this at the fingertips of every member of your key identified staff. And basically, this is just cut and pasted from that. But certainly, if you have an emergency situation where a child is having difficulty breathing, or maybe they're demonstrating characteristics of a seizure or some other form of distress, that you are immediately calling 911 and seeking backup emergency support. And basically, this section of the emergency procedures from your school's handbook spell that out. The second part is the school staff's response. Are there any questions? I'm just pausing for questions before I move to the last section. Already talked about the importance of making sure that all of your key identified staff participate in CPR and first aid training. So the last section that I want to look at is where can you find all of these resources that have been developed to support your school's compliance with the legislation around emergency seclusion and restraint. These materials are located on MyNHA. There's an icon that says special education. If you click that site, it takes you to a window that looks like this, or to an icon that says emergency seclusion or restraint. You can click that icon and it brings up, it opens the screen to this viewing, and on the left-hand side you'll see a window that says Michigan. Click here to enter Michigan seclusion or restraint. When you click that, it takes you to a page that looks like this. In the middle of the screen, you can see that we have put the entire document together in one document so that all you have to do is click it and you can print it and have all of the resources together. I highly encourage you to do that so you have all of the materials, that you have the Michigan policy for emergency seclusion and restraint at your fingertips, as well as the documentation forms. And I'm going to actually walk you through that myself. I'm going to actually go into the process so that you can see me do this. If I scroll down, you can see special education. You can also hyperlink it with a star so that you have it up in your favorites. I'm going to go ahead and go here. In this particular case, the layout shows the screen like this. I'm going to go up to CPI and open the screen, and voila, you can see the documentation forms. Michigan's procedure was integrated with all of the other states. However, because there was such significant shift in the legislation, we had to separate it out. You could go to this link, click the link, and this is the screen that you see. Now, if I click this link, it will open up all the documents, and I'm going to do that in a minute, but I want you to see something down towards the bottom of the screen. We have created, or Caitlin has created, form-filled versions of all of the documents. And so you can go into the emergency seclusion and restraint documentation form, click it, and it's a form-filled version of the document. You might ask, well, why is that important? You have two places that you need to document emergency seclusion and restraint. One is on this documentation form, and the other is within My NHA. It will pop up when you record a level 5 behavior. And there are some questions that get prompted that are very, very similar to the questions that are in the documentation form. If you use the form-filled version of the document, you can simply do a cut and paste into My NHA so you're not having to retype all of the information. And you might ask, well, why do we have to do it twice? Unfortunately, the only way that My NHA can capture the data is for the data to be hand entered into the system. Our goal is to create an integrated documentation form so you only have to complete it in one location and then you can print it out so it's accessible to the parent. However, right now the system is not designed to be able to do that, and I apologize that it's not, but it's something that's just going to take some time to integrate, but that's the goal of the department, is to create it so you're not having to dual entry. So now I'm going to take you to the documentation forms, and you can see at the very beginning this is our practices and procedures document. If I go to the third page of the form, it lists out all of the documentation forms and the exhibit. I want to point out that the Michigan policy for emergency use and restraint is listed at 7.2. This is your Bible. This document spells out exactly what we are required to do within the legislation specific to emergency seclusion and restraint. We did not restate all of the requirements within our procedures document. It would have been too lengthy to do that. The other really key important document to take a look at is 7.3, the MDE Seclusion and Restraint Frequently Asked Questions document. In fact, I think that document is extremely helpful because it will provide you with scenarios that could happen within your school, and it provides the Department of Ed's response to that. For example, if I've got a child in seclusion in a dean's office and the dean is standing at the door and the child is in the classroom, is that considered seclusion for the child? Read the document so that you know the answer to that question. I want to move you down to, well, this very first document that we provided was very intentional. We ask that each school complete this document and customize it specific to the school. And again, this is Form A, Procedures for Emergency Seclusion and Proactive Intervention Resources. We ask that you customize this to your school so that your staff would understand who are your emergency seclusion, or your key identified staff or your response team members, and also what is the process or the procedure for seeking assistance. But on the front page of this document, we listed the de-escalation tips so that your general ed teachers, so your staff would all have this information at their fingertips. At the end of the document, we also provided you with resources and links to resources that can help your teachers with proactive interventions specific to both behavior and academic interventions. Please note that the first two documents are the documents that were created by Intervention Services. One of them is a link to the document for systematic intervention, and then the second one is for positive behavior interventions. It's the manual that Tara Colvin's team put together, and it provides you with the location for that document. We also provided you with links to many, many other documents, again, so that your team can be proactive and continue to build their knowledge and skill set around interventions for behavior. I'm now going to drop down. I'm not going to go through all the forms. You can do that independently and certainly reach out if you have any questions. But I want to take you to a flow chart that I think should be your Bible to help you. We took both the MDE policy and the Q&A document, and we tried to develop a flow chart that was consistent with all of the required components. And within this flow chart, we also identified which forms you need to use to help you be in compliance. So I'm going to take you to the second page of this document, where you've had an incident, you've provided the parent with a copy of the documentation form, you're scheduling this debriefing meeting to take place within 1 to 3 school days following the incident, and then you're going into the conversation and you're asking the question about whether or not the child needs an emergency intervention plan. Please note that there is an arrow that along the left-hand side of this flow chart that takes you to the third page, and it spells out what the procedures are in the event that the team determines that there's a need for an emergency intervention plan. I want to just say this. If you have a child in your school right now that you anticipate you might need to engage in emergency intervention because of behaviors in the past or current behaviors that you're seeing, then you need to proactively initiate this process. Please don't wait until an incident happens. Go ahead and be proactive. Take a look at what positive behavior supports you need to put in place and develop your emergency intervention plan so that the staff are prepared and know exactly what they're going to do in an emergency situation. Please note that we also included that the plan is considered a draft, and as a second component, it needed to have a peer review. Now, it is up to you within your building to determine who is going to be a party to that peer review. But I would encourage you to look to personnel such as your social worker, maybe a special ed staff member who's had some in-depth training around positive behavior supports and the emergency seclusion and intervention, or perhaps it's a dean or one of the administrators in your school. You need to define who that's going to be, and you need to make sure that those procedures are put in place. Once that review has taken place, if revisions need to happen, then those revisions need to be implemented within the plan. A copy of the plan needs to be provided to the parent and to the staff members who are going to be implementing the plan. You also need to save a copy of it within the child's file and implement the plan. And if there's a reoccurrence of the behavior, you need to do the same procedures. And again, the reason for that is to make sure that we're being proactive and planful, and we're trying to do everything we can to avoid the need to implement emergency seclusion and restraint. There's also a provision in which there's a request that the school's improvement team takes a look at behavior and the school-wide practices, including the seclusion and restraint data and discipline records for the school, to make sure that the school's plan is addressing and problem solving around student behavior. At this point in time, I've concluded the presentation specific to emergency seclusion and restraint. I'm wondering if you have any questions. We have a couple of remaining minutes. Do you have any questions?
Just some thank yous, Madam Chair.
Well, I'd like to take this time to thank all of you for participating in the webinar. I appreciate your support in making sure that we're implementing our emergency seclusion and restraint procedures consistent with the legislation that's really designed to not only keep the child safe and other children safe, but also to make sure that we're operating consistent with the legislative requirements. Appreciate your leadership and support of your staff in ensuring that these procedures are followed. If you have any questions, please feel free to reach out to members of the special education team and the school safety team. And I wish you well as you continue to progress into the 17-18 school year. Thank you again for your time today and your support.